September is Suicide Prevention Month. It's a crucial time to spotlight mental health and the urgent need for open conversations about suicide. Jennifer Battle with the Harris Center is here to talk about one of the important resources available to help people with suicide, and that's the suicide hotline 988. Good morning, Jennifer. Thank you so much for coming in, continuing this conversation. This is a really important conversation to have and to let people know that help does exist. One of those lifelines is 988. It's a number you can call. It's a number you can text. For people not familiar with it, talk to us about how it works.
Absolutely. Yes, 988 is a wonderful service. It's available 24 hours a day, 365 days a year. As you said, you can call in, you can text in, you can even chat online if you just Google 988. So the way that it works is if you feel like you need to talk to somebody, if you're feeling stressed or overwhelmed, if you're worried about impending tropical storms in our neighborhoods, and that's causing you fear and anxiety, then you can reach out to us, and there'll be a trained, caring, non-judgmental mental health professional on the other side of that conversation to support you and, if necessary, connect you to other resources and care.
That's really incredible. Again, this number will be working through any sort of tropical system that we might be dealing with midweek this week.
Absolutely. 988 is interesting in the sense that it's part of a national network of crisis centers who work collaboratively to make sure that coverage happens. So thank goodness we rarely have any sort of impact here in our call center in Houston because we have people that are staffed all throughout the state. But no matter what, wherever you call across the U.S., if there ever was a challenge, that call or that text will still be answered because we work in partnership with many centers.
And we want to mention too, if it's an immediate emergency, that's for 911. You
Yes.
call 911.
Absolutely. Great point.
Resources. You mentioned that this can connect you to other resources. Talk to us about what those other resources are.
Absolutely. Well, our 988 program is housed inside of the Harris Center for Mental Health and IDD, which stands for Intellectual and Developmental Disability Services, which is right here in Houston in Harris County. And we have all kinds of wonderful services for folks. Outpatient clinics for adults and for children and for adolescents. If somebody's experiencing a crisis, we have mobile crisis outreach teams, and we have a wonderful program called Texans Recovering Together, which is a program that we're working in partnership with the Texas Department of Disaster Behavioral Health to help our specific community because of the challenges that we had with the derecho and with Beryl. So we know that the incoming tropical storm potentially is going to cause a lot of stress and anxiety for folks right now, and we're happy to also connect them to free crisis counseling, information, resources. If people need that, they can call in through our main line, which is 713-970-7000.
Jennifer, elaborate on the parallels. I'm so glad you brought up the derecho from May and then, of course, Hurricane Beryl. What did you observe during those two storms, and how are you using those types of experiences to prepare for this potential system making its way to us this week?
Absolutely. Well, what we know about helping people recover and be resilient from the type of disasters and tropical systems that come into our Gulf Coast city is that connectivity with community is key. Same thing when we talk about suicide prevention work. It all works very closely together. So what we're really encouraging people to do all seasons, not just during hurricane season, is to reach out, know your neighbors, who in your street or your building is vulnerable, who do you need to maybe pay a little bit of extra attention to, make sure that people have power, electricity, access to food and water, and just know each other. So some of that is just some basic mental health care and support, is staying connected to one another in all times, not just during disaster, but it also helps lower suicide rates as well.
We're constantly spotlighting neighbors, right? Community, that sense of community. I know it sounds cliche, it is cliche to say, but it truly does take a community, and getting to know your neighbors, checking in on your neighbors and your neighbors' pets too. Do not forget your neighbors' pets.
Absolutely.
But getting to know them and understand them can be so beneficial. It can really save lives, especially during times like this.
Absolutely true.
Yeah. For more information, Jennifer, where can folks go?
The 988 24/7 365 for crisis or behavioral health care, and then the Harris Center also 24/7 365 at 713-970-7000.
Okay, we so much appreciate your time this morning.
Absolutely.
Jennifer Battle, thank you so much for stopping by.